Hi, I'm Dr. Stacey June here at Advanced Specialty Care. We have a model today who's going to talk about facial rejuvenation, non-invasive with fillers. We have a lot of different products and they can treat several different areas of the face. We'll describe that a little bit in just a few moments. So this patient is looking for ways to make herself feel more youthful without looking changed or different. She's starting to have some early signs of mid-face loss. As you can see, there's some flattening of the cheek here, and along with some fullness here. So as we get older, our youthful cheek begins to descend, and that descent in our cheek volume falls forward and starts giving us this crease in here, and this fullness in here, creating our jowl, our nasolabial fold, and our early marionette. There are products we can use to fill these areas, to soften these folds, but sometimes that just makes us seem very heavy in here and doesn't address the fact that we've lost our mid-face volume. So by adding a product to her cheekbones today, we're going to try and draw some of this volume back up and give her that more youthful, heart-shaped look to her face. This will not leave her looking apple-cheeked or chipmunk-cheeked. This is just to restore some of the volume in that area. This is a series of small injections. You will see an immediate result as we inject her face and an immediate restoration in volume in this area. Now this product is called hyaluronic acid. Hyaluronic acid is something that is naturally present in your skin, and therefore very rare would you have a reaction to the product. It is naturally our water-binding property of our skin. So by adding more hyaluronic acid underneath the tissues, we're causing more of a water-binding property, more plumping, but also more smoothing and hydration to the skin. So while you'll immediately see an improvement in the shape of her face today, she's also going to receive a benefit over the next few weeks of noticing a better quality of skin in the area. Sound like a plan?
Sounds good.
All right. Prior to injections, all of our patients are treated with a numbing medication. So we have pre-treated her with a topical numbing medication to make the injections less sensitive. The products themselves come in these pre-filled syringes, and it is mixed with some lidocaine itself. So the injections do get more comfortable as we go as this numbing medication kicks in. We're going to start with your first injection right about here on your cheek. You're going to feel a little bit of a pinch, followed by some pressure as the medication goes in. How are you feeling?
Good.
Good. Second injection right out here for you. So you can see immediately with our model here, just a few injections of the product, an improvement in that cheek shape. She has more contour along her cheekbone. Without looking full or apple-cheeked. It has softened some of her creases in here and as well as in here. If you compare the right side and the left side on our patient, she's not looking full or apple-cheeked, but she has lost that hollowness here and given her more of that youthful from this straight look here to more of a angle and a youthful lift in her mid-cheek. This can be easily followed with a little filler in through here and here if she would like a further correction. And while you can see the immediate rejuvenation in her cheek and that more youthful heart shape, there are other fillers we could use on other areas in the future. For example, if she wanted to treat this tear trough area or volumize her lips, there's a much thinner product, also hyaluronic acid by the same company, called Volbella, which would adequately hydrate and fill these areas for her. We have two other products, Ultra and Ultra Plus, which are meant to fill in these areas in here to try and, again, further smooth that contour. And one of their newer products called Velour, which works more for those etchy lines that we sometimes get when we smile out to the side. These products are also good for vertical lip lines as well. So depending on your area of need, we can safely correct it with a hyaluronic acid in a So at the completion of her treatment now, we have 1 cc of Voluma in each of her cheeks, giving her that more youthful heart face shape to her face, a restoration of mid-face volume, and just drawing up the tissue into that more youthful look. You can always fill in other areas. Voluma can also be used here in her temples and in her jaw to help redefine some structure. But I think that this is a perfect, subtle, yet significant improvement in her mid-face contour.